We are going to discuss one of the important topic, that is the parotid gland. It is a large salivary gland of serous type and it is located where? It is located in the parotid bed. One of the important speciality of the parotid gland is it is well enclosed in a parotid capsule. How is the parotid capsule is forming? It is formed by the investing layer of deep cervical fascia which splits to form two laminas, the deep lamina and the superficial lamina. The deep lamina, it extends between the styloid process and mandible get thickened to form the stylomandibular ligament which separates the parotid gland from which gland? It separates the parotid gland from the submandibular gland. One of the important applied aspect of the parotid capsule is the parotid swellings are very painful due to the unyielding nature of the parotid capsule. The parotid swellings are very painful due to the unyielding nature of the parotid capsule. So, let us have a quick look on the external features of the parotid gland. It is the inverted three-sided pyramidal structure. It have an apex, four surfaces and three borders. Which are the four surfaces? The base or superior surface, superficial surface, anteromedial surface and posteromedial surface. The three borders are anterior border, posterior border and medial border. The apex, it projects towards the downwards. The base or superior surface, it projects towards the external acoustic meatus. The superficial surface, it is related to the skin, superficial fascia which contains the anterior border of the greater auricular nerve, the superficial parotid lymph nodes, the rhizoras muscles and platysma muscle, then the parotid fascia. Then the anteromedial surface, it is related to what? The medial pterygoid, the masseter muscle, the lateral aspect of the temporomandibular joint and the posterior border of ramus of mandible. Then the posteromedial surface, it is related to the muscles that arise from the styloid process and mastoid process. And there is two important structures that enters the parotid gland through the posteromedial surface. Which are they? The facial nerve and its branches and the external carotid artery. Among the three borders, the anterior border have greater importance. Why? Because so many important structures are emerging out from the anterior border. Which are they? From above downwards, they are temporal branch of facial nerve, zygomatic branch of facial nerve, transverse facial artery, upper buccal branch of facial nerve, parotid duct, lower buccal branch of facial nerve and marginal mandibular nerve. Again repeating, from above downwards, temporal branch of facial nerve, zygomatic branch of facial nerve, transverse facial artery, upper buccal branch of facial nerve, parotid duct, lower buccal branch of facial nerve, marginal mandibular nerve. So, let us have a quick recap on the external features of the parotid gland. Among the four surfaces, the important three surfaces, that is the superficial surface. It is related to the skin, superficial fascia which contains the superficial parotid lymph nodes, anterior border of the greater auricular nerve, rhizoras and platysma muscles. Then the parotid fascia. Then the anteromedial surface. It is related to the medial pterygoid, masseter, lateral aspect of the temporomandibular joint and the posterior border of ramus of mandible. Then the posteromedial surface. It is related to the muscles that arise from the styloid process and mastoid process. Then which are the important three structures that enters the parotid gland through the posteromedial surface? They are the facial nerve and its branches and the external carotid artery. Then the important anterior border, the important structures that emerges out from the anterior border from above downwards. They are the temporal branch of facial nerve, zygomatic branch of facial nerve, transverse facial artery, upper buccal branch of facial nerve, parotid duct, lower buccal branch of facial nerve and marginal mandibular nerve. When we study about the parotid gland, its duct have also importance. Which is a duct? The parotid duct. It emerges from the middle of the anterior border and it pierces three B's. Which are the three B's? The buccal pad of fat, buccopharyngeal fascia and buccinator muscle. Which are the 3 B's? Again repeating. The buccal pad of fat, the buccopharyngeal fascia and the buccinator muscle. Then it opens into the vestibule of mouth opposite to the upper second molar teeth. Then it opens into the vestibule of the mouth opposite to the upper second molar teeth. Thank you.